Disclaimer: the contents of Studio 151 podcast and the TU Communication Disorders Connection podcast do not represent the views and beliefs of the University of Tulsa and the Mary Kay Chapman Center.
The content we are covering in this podcast reflects knowledge we have obtained from the ASHA practice portal, as well as our own personal, clinical, and educational experiences. Hello, welcome back to another episode of the TU Communication Disorders Connection podcast. This is your host, Alyssa Hall. Today we are beginning our discussion of the SLP Big 9 area of hearing. And joining me in this episode is Brenna Golden, who is a first-year graduate student at the University of Tulsa and also one of my classmates.
Hello, thank you so much for having me.
We will go ahead and get right into our questions if you're ready. When we're thinking about an SLP scope of practice, often because it's in the name, speech-language pathologist, we're thinking about those areas of speech and language. So when we're talking about hearing, how does that domain feed into those areas of speech and language development?
Well, most children are exposed to language through verbal communication, actually, as soon as they are born. As we know with learning anything, modeling is really important. And as soon as a child is born, they're going to start being exposed to their parents' speech, people around them. So adults modeling that language use on a day-to-day basis by speaking to and around children is really important. But children who do not have access to that sound are not receiving the same auditory input that a child with typical hearing will be. So they're really missing those sounds, words, phrases, and sentences that are really integral to start building those speech and language skills.
For those children who aren't receiving that same access to verbal language input, what are some ways for you to support their language acquisition?
So there are a lot of different options, but one of the critical ways to support children who are deaf or hard of hearing is identifying those needs early, while they're in that critical period of 0 to 3 years of age. And then there will be a discussion. Usually an audiologist will speak with their parents about identifying the appropriate technology or alternative communication modality that is appropriate for them to foster language and speech skills. Intervention for hearing looks different for everyone, and that is something that's really important to remember. Some children or parents may choose to use a device to help them access sound, while others may choose a different form of communication, such as ASL or manual signs. Another important component of intervention is family and community involvement. It's important to remember that the speech-language pathologist is not the primary person the child will be communicating with. So it is really vital to make sure that family members are up to date on the intervention plan and are able to implement it on a day-to-day basis.
Yeah, that's a really good point. And as you mentioned, you're pulling in the family and community of the child, but you're also working with other professionals on their intervention plan. One of the most common collaborators is an audiologist. So what are some ways that SLPs and audiologists work in collaboration for their clients' intervention?
SLPs will frequently conduct hearing screenings to screen for a potential hearing loss. If we identify a child who has potential hearing loss, we cannot diagnose it, so we'll have to refer them to an audiologist to conduct a full evaluation. We also learn a lot from audiologists. For example, an audiologist might recommend to an SLP that they need to wear a hearing amplification device during a session or communicate with the client by sign. And so it's really important that we're listening to those recommendations by the audiologist. And then again, if we have any concerns, for instance, if we're conducting therapy and we notice that our client is exhibiting some signs of hearing loss, we really need to make sure to refer them to an audiologist and conduct those hearing screenings so that they can receive the care that they need.
You mentioned those hearing screening procedures that are within an SLP's scope of practice. We have some experience administering hearing screenings.
Yes, we do, yeah.
In our clinical practicum thus far. So can you talk to us a little bit about some of the differences between a hearing screening and a full audiologic evaluation?
The big difference between a hearing screening and a full hearing evaluation is really time and the purpose. So the purpose of a hearing screening is just to identify if a student or client needs to be referred on to an audiologist. And it's not making an actual diagnosis. Usually when I'm in the schools and doing a hearing screening for each student, it usually takes about 5 minutes at the most. And really that's because we'll present for children, it's at 20 decibels, and we'll present at 1,000, 2,000, and 4,000 hertz in both ears. If that client or student does not pass that hearing screening, we'll indicate that and they'll be referred on to an audiologist for a full evaluation, and that will take much longer, and the purpose of that is actual diagnosis.
Brenna, in your experience conducting hearing screenings in the schools, have you run into any challenging moments? And if so, what are some ways you worked around those?
Yes, I would say the younger the child is or the student, the harder it is to screen them. Especially usually we'll go to elementary schools, and so we'll get some preschoolers, and of course they do not want to sit still in a chair and be quiet. So it's really difficult kind of convincing them to play that game of listening for those sounds and being quiet so they're not disturbing, because usually we'll do our hearing screenings in like a big room. So everybody will be conducting their hearing screenings at the same time. And so you have to make sure that your student is staying quiet and actually participating. And so that is a really big challenge, is just getting them to participate and sit still. But usually you kind of have to frame it more as a game. And so they'll get really excited. And if you kind of have to make sure that you're conditioning them appropriately. So yeah, that's probably the biggest challenge, is getting them to sit still and be quiet.
Yeah, absolutely. Especially with those little ones. As student clinicians have to collaborate when someone else will just have to jump up from their screening, step into another. And sometimes a client will not want to just raise their hand, or a kid will not want to participate in the way that you tell everyone to. And so you'll have to just alter the game.
Yeah.
And you'll have to maybe give a high five instead of raising the hand. Or maybe you'll have to accept them just turning and looking, or giving some indication that they're hearing the sound instead of what you told them you were looking for. So it's really just about listening, watching, looking for those signs, and using those signs to get what you need out of the initial screening.
Yeah. If they don't pass the hearing screening, trust yourself and be like, okay, I need to refer them, and not being afraid of indicating that they didn't pass the hearing screening. Because I think that's a big thing for some people, is they're keep double checking and keep replaying frequencies, so it'll end up taking much longer. But if there's any doubt, I think it's always important to refer them. I think is a big thing that we talked about. Yeah.
Absolutely. Always over refer, over under.
Yeah.
It has been a really valuable experience, I think, so far, to administer these screenings in schools.
And super fun, too.
So
I know we talked about the
fun.
challenges, but it's usually very fun, and it's really fun interacting with the students. So
It really is. Okay, Brenna, I want to thank you again for coming to talk to us about hearing a little bit in this episode. Thank you for joining us today.
thank you so much. It was super fun.
Everyone who listened along, we appreciate you tuning in, and we hope you will join us for another episode. Bye.
For further information or podcast ideas that you'd like to share with us, please reach out at 918-631-2504. We would be happy to chat with you.
Thank you, Studio 151, for letting us record. We look forward to recording future podcasts.
Remember, communication is not just about words. It's about understanding, empathy, and connection. Until next time, keep listening, keep learning, and keep communicating.